So my project for the Kilachand Keystone was working with the Environmental Health Department at Boston University School of Public Health, examining the cold weather health outcomes within urban residents, specifically the greater Boston area. The purpose of this project was to characterize the burden of cold weather injury amongst Boston residents seeking care at BMC, as well as to identify the associated risk factors such as gender, age, race, etc., through a case control study. And some things we wanted to see was whether housing instability had any sort of significance in the health outcomes. Some background is Boston has on average 25 days per year with below freezing temperatures. And this can pose significant morbidity to individuals who lack predictable housing. And more than 200 patients actually had cold weather injury, which includes frostbite, hypothermia, chilblains within the year of 2014. And BMC, we focus on BMC for this because it is the leading safety net hospital and the busiest trauma center in New England. And so here I have a close-up of my results section, and I want to focus a little bit on tables 2 and 3. And here I show multiple variables and their respective associations with the cold weather injury. And we see that homelessness and being Latino race and alcohol use had interesting associations. And from here, we further tested through multivariate regressions with the 3 variables and saw that unlike what we had initially hypothesized, homelessness actually did not have the association we had expected of having with having a cold weather injury. And something to note as well within my data set was that patients with histories of alcohol abuse have 3.66 times the odds of being homeless. And so there were very interesting results. And so we determined that with this result, it's a great baseline to go off of for further studies, looking at similar cold weather related health outcomes. But this time, but further studies would it would be better for a greater scope in terms of data being extracted from multiple locations of health clinics from the greater Boston area, just so that we can better characterize the risk associations for cold weather injuries. Thank you.